Hello everyone, continuing with the last lecture of the blood supply of eye, today we will be learning the venous supply of the eye. So the venous supply can be divided into three main parts. What are these three parts? First comes your veins. Veins which drain blood from the eyeball. So these veins are the central retinal vein. Then comes your anterior ciliary veins. Then comes your posterior ciliary veins, and at last the vortex veins, the vena vorticosa or the vortex veins. We'll be talking about each individually. The central retinal vein, it will also travel along with the central retinal artery piercing the optic nerve, and it will drain blood from the, of course, the retina. It will drain blood from the retina. Talking about the ciliary veins, the anterior and posterior, so they will be draining blood from the uveal tissue. What are the three parts of uveal tissue? Iris, ciliary body and the choroid. Very nice. Then lastly comes your vortex veins. The vena vorticosa, also known as vortex veins, they are 4 to 8 in number. They are 4 to 8 in number in each eye. Some are located superiorly, some are located inferiorly. So these small veins, they all will drain ultimately into the orbital venous networks, through the orbital venous networks into the main venous channels. So somehow it goes like this. The veins drain blood from eyeball, then goes into the orbital venous channels or network, then they go into the main venous channels. So we learned the different veins, these four veins. Apart from these four, there are also many other veins which will correspond to the arteries, like the lacrimal artery, so the lacrimal vein, medial palpebral vein, etc., etc. But these four veins are important over here. Talking about the venous networks, so there are two venous networks, the inferior and the superior. Inferior one is the largest. It is larger than the superior venous network. Superior, as the name suggests, it will be located superiorly in the orbit, that is above the levator palpebrae superioris muscle. And the inferior venous network, it will be located near the orbital floor. These venous channels, they will ultimately drain into the main venous channels. Main venous channels include the superior, middle, inferior, medial ophthalmic vein, the angular vein and the cavernous sinus. They ultimately get tributaries from various orbital structures. Again, recalling its name, superior, middle, inferior, medial ophthalmic vein, like the superior ophthalmic, middle ophthalmic and so on. So these four are the ophthalmic veins. Then comes your angular vein and your cavernous sinus. Now, out of these veins, usually the superior ophthalmic vein is the largest and the principal vein. It is the principal vein of the eye. So this was all about the venous supply. Quickly recalling the venous supply, first comes your smaller veins which will drain blood from the eyeball. This include your central retinal vein, the anterior and the posterior ciliary veins and the vena vorticosa. The vortex veins or the vena vorticosa, the superior vortex veins, they will join to form the superior ophthalmic vein, and the inferior vortex veins will join to form the inferior ophthalmic vein. Fine. Join means they will ultimately drain into these veins. Then comes your venous channels, the inferior one and the superior one, and finally comes your main venous channels, the ophthalmic veins, the cavernous sinus and the angular vein. So this was all about the venous supply of the eye. Do like the video, and if you have any doubts or feedbacks, do let me know in the comment box. Thank you.